Brothers and sisters, warm greetings from Sri Balaji Vidyapith, popularly referred to as SBV. I am delighted to meet you all once again through Channel 1. I thank you for your continuous support in this endeavor. Today's topic is about the role played by clinical laboratory services in healthcare. Clinical laboratory services represent a fundamental and important component of a functioning hospital. From the first point of contact, when the baseline investigations are done for assessing an overall view of the general health of the patient, to the advanced assessment modalities personalized to the patient's specific health conditions, the laboratory serves as the backbone of the existing hospital armamentarium. A laboratory does not always come to the limelight. However, this does not demean its importance on any account. The fact remains that the laboratory services do not get acknowledged for their invaluable support. But then we need to appreciate the truth that the disease diagnosed and treated would nevertheless be attributed to clinical acumen and experience of the treating physician, as it should be. The credit that the clinical laboratory deserves might not always reach it. The general public might not be aware of the reference ranges and complex diagnosis of the various chemical tests may reveal, but they do understand the need behind such tests. Not every disease is a clinical framework. The majority of diseases involved a sample traveling from the bedside to the lab and the report deciding the outcome. Patients look forward for the advantage of getting all the required tests in one place with the most optimal clinical correlation. While the public benefits from this invisible savior, it demonstrates a quality, a standard to which it holds itself, and thus the need for accreditation and quality control acquire great importance. The normal functioning of the clinical laboratory services must be upheld to meet certain standards and requirements. Sensitizing and preparing our clinical laboratories to higher standard is not the mere purpose to be enabled for the purpose of going through an inspection or assessment. It is the base upon which the hospital depends and functions. Our diagnostic or clinical laboratories must be of the highest quality because the action culminates in reliable and accurate diagnosis or prognosis. The clinching of a diagnosis largely depends on the accuracy and precision of the laboratory services. Accuracy of laboratory results depict the truthfulness provided, whereas the term precision essentially refers to the reproducibility and reliability of the laboratory data. Accreditation, while depending on a single time inspection or assessment, just serves a major function. It tells us how we have maintained standards and incidentally announces to the public indirectly that the high standards have been set up by the diagnostic laboratories that had enabled them to obtain accreditation upon assessment.
Sri Balaji Vidyapith provides laboratory services for clinical care, diagnosis and follow-up of the patients. It is inclusive of various sections working in unison at the main and off-campus hospitals, namely Mahatma Gandhi Medical College and Research Institute and Sri Sathya Sai Medical College and Research Institute respectively. The central laboratory houses the diagnostic facilities related to hematology, clinical pathology, biochemistry and microbiology. Several investigations pertaining to various parameters are enabled on the biological samples obtained from the patients that include blood, urine, feces and tissue etc. The hematological investigations include complete hemogram, peripheral smear examination and workup for anemia and leukemia, which reveal the blood cell counts and their morphology. Physical, chemical and microscopic examination of urine samples, body fluids, sputum and semen are carried out in the clinical pathology section, which aid in the identification and prognosis of a spectrum of illnesses ranging from infection to malignancy. The biochemistry laboratory performs a multitude of investigations which range from primary line of tests such as blood glucose, renal function test, liver function test, lipid profile, calcium, phosphorus, magnesium, glycated hemoglobin and urine protein, to assays for anemia, bone, cardiac biomarkers and tumor markers, fertility profile and hormones, maternal care, routine newborn screening, infectious diseases testing to identify viral load and tuberculosis and rifampicin resistance are done in the biochemistry laboratory. Support for critical care is provided by analysis of pH, blood gases, electrolytes and metabolites. Microbiological tests are performed to identify bacterial, viral and fungal infections in the form of culture and sensitivity testing, serological tests and molecular tests. The specimens obtained from the surgical procedures are tested in the histopathology laboratory, where conventional tests, oncology workup and special stains are performed. Frozen sections are used to provide immediate diagnosis for peroperative decision making and for immunofluorescence testing for eliciting complete dermatology diagnostic profile. Immunohistochemistry panel of markers for various tumors, especially for breast carcinoma, are carried out. All the laboratories are well equipped with quality management systems. The automated and semi-automated instruments are regularly calibrated. The labs participate in external quality assessment scheme with accredited institutions and organizations such as AIIMS New Delhi, CMC Vellore and RML laboratories. Internal quality control is maintained by running 2 levels of quality control samples twice a day, which is monitored by Levi Jennings chart and Westgard multi-roles. Faculty and technicians are trained. Corrective and preventive actions are undertaken. Internal audits are conducted on a regular basis and reports submitted to the internal quality assurance cell. Quality indicators such as turnaround time are also monitored. In addition to the above quality checks, the COVID-19 RT-PCR facility has been effectively and efficiently functioning at SBV. The RT-PCR labs at the main and off campuses are NABL accredited. The National Medical Commission mandated biosafety level 2 virology lab is also in place.
Laboratories forming the backbone of a hospital have yet another significant role to play. They form a considerable part of every single research study and project, from case studies to full-scale population-wide studies. Frameworks for disease classification and reference ranges for several parameters depend upon laboratory results. Any new discovery involving biomarkers, individual chemical entities for prognostication or diagnosis all involve the reception of samples in the lab and an accurate result that truly informs the clinician of a finding. Not only clinical trials, but also a major chunk of research involves diagnostic methodologies and their efficacy. The specificity and sensitivity of tests in identification of a disease is one of the major areas of research. The accuracy of clinico-pathological correlation is a focus of practical importance in research studies. Major breakthrough in novel diagnostic procedures, tissue culture, animal and human studies on disease and drug effects possess the laboratory as their milieu. Equipment such as slide scanner and image analyzer are useful for research as well as for developing big data and artificial intelligence, which are coming up in a big way the world over.
Greetings from Sri Balaji Vidyapeeth. As an inherent component of SBV's continuous quest for quality conscious endeavors, the state-of-the-art services and technologies are promulgated, and more importantly for the larger benefit of the underprivileged patient community. SBV feels delighted in stating that on the 11th of February 2022, new facilities at Mahatma Gandhi Medical College and Research Institute, a constituent teaching unit of Sri Balaji Vidyapeeth, were dedicated to the patient community by Thiru N. Rangaswamy, the Honorable Chief Minister of Puducherry. SBV's motto, "Let well-being prevail," bears ample testimony to our humble endeavors. Thank you.
While promoting quality patient care and accomplishing research activities, it is imperative to keep updated with recent advancements, as it is quite essential in sustaining quality. With the advent of automation, the quality and accuracy of tests have improved exponentially. The analyzers reduce the manual errors and turnaround time. Interfacing the instruments is a mode of delivering the results to the doorsteps of the patients and treating physicians. Molecular diagnosis is the method of choice for the identification of various infections, solid tumors, hematological malignancies, and genetic disorders. Flow cytometry, fluorescent in situ hybridization, microarray, and polymerase chain reaction are useful for diagnosis, prognosis, and theranostic purposes. Theranostic services refers to the combination of therapeutic and diagnostic services. The most recent successful application of molecular method is real-time PCR for COVID. Laboratory medicine has immense potentials for the use of artificial intelligence and Internet of Things. Prudent and judicial amalgamation of laboratory investigations, molecular pathology and artificial intelligence will pave the way forward for personalized medicine in the years to come. I wish you the best of health. Do remember to continue practicing physical distancing, wearing masks, and strictly adhere to hand hygiene. Stay safe. God bless you. Jai Hind.